Hello, everyone, and welcome to Psychedelic Insights. I'm really excited to bring this episode to you guys today. Me and Jake are going to be breaking down ATAI Life Sciences strategic investment into Beckley Psytech. This is incredibly exciting for the psychedelic sector in general, and really exciting for ATAI investors. I'm going to let Jake take it away now, and we'll get going.
And I'll start off by saying I am an ATAI investor. I increased my position substantially when the news was launched when the news was put out. Um, yeah, we got a muted reaction at the market open. I was happy to take advantage of that. You never know, it could go back down either way. Very long-term mindset with ATAI. Talk about creating value for your shareholders here. Adam, you and I have discussed, we think ATAI is a great company. We were worried personally that they were relying on a phase 2B trial in a very tough indication of cognitive impairment associated with schizophrenia. Again, we were a little bit worried that was their big catalyst for 2024, but now they have quite a bit of catalysts through strategic investments in the space, and it's really excited. Let me just say, Beckley Psytech, and Adam, I've told you this as well, probably my favorite company in the space in terms of their hallucinogenic psychedelic programs. I'm very excited about 5-MeO-DMT, very excited about IV psilocin, and just for ATAI to take out 35.5% of this company for $50 million seems like such a steal. And it's a brilliant investment. And, we're just going to go more into it here. Adam, were you?
Jake, can I ask you a quick question?
Yes.
So what is it about Beckley SciTech that excites you so much?
So again, I've always, I've stated this, that I think short acting psychedelics will not only scale better. I think that's pretty obvious to people. I think they could be even more effective for many people than psilocybin. That's kind of what I'm thinking. And let me just say, the Beckley's 5-MeO candidate is very interesting to me. So, Florian and Srini actually came on to Shroom Stocks once for Q&A, I think after maybe their financials came out. And I asked a question about shorter acting psychedelics, and Srini has made it very clear that short acting psychedelics are good, or have the potential to be good. Obviously, these guys are driven by the science, so they want to see that data first. But he was also quick to point out on Shroom Stocks that they don't want the experience to be too short. They want that window of 45 minutes with VLS-01. With Beckley's program, the trip lasts around an hour.
Or which
And
program?
BPL-003, it's their intranasal formulation of 5-MeO-DMT. And Srini pointed out that with the other short acting psychedelics, that maybe hinting at that with 5-MeO specifically, that quick, almost maybe too intense trip to be therapeutic, or to get the most out of it. Obviously it could still work, but to get the most out of it, they want this trip seems extended, more drawn out, perhaps less intense. Obviously the goal is to get them to a peak experience, but a little bit of a smoother ride. And this Beckley asset, BPL-003, it's again last 60 minutes. They had great safety data.
That's the IV psilocin, right?
No, BPL-003 is 5-MeO-DMT intranasal formulation.
Oh, okay. Sorry about that.
And yeah, we'll definitely touch on ELE 101. But and we're gonna take a look at ATAI's catalyst table later on in this video here. But just with Beckley alone, huge phase 2B trial in treatment resistant depression, large study, 225 people, Active placebo, sort of, medium dose, high dose. It's structured similarly to Compass Pathways phase three trial. At least actually Comp 006 to be more specific, with redosing. Um, but
Let's get cracking, dude. I'm
yeah, I'm
excited.
sorry. I'm sorry. Let me just say one more thing. I'm sorry. I'm taking a little slow here. It's just I am beyond excited. I had wanted to invest in Beckley so badly. I was so upset they were a private company, and now I have access through ATAI to this amazing company. Um, Also, again, alcohol use disorder. I think it's gonna be. I think it could be like first line treatment one day. I really believe that. I think the results that we're going to see from 5-MeO, I've said it. I'm putting my money where my mouth is. I think the results are going to be phenomenal, and it's really exciting. So let's look at the transaction terms. Atai owns 35.5% of Beckley Psytech, 50 million total investment, 40 million direct investment into the company, 10 million in secondary share purchases, one-to-one warrant coverage with 30% premium on primary issuances, so that they have the opportunity here to increase their stake in Beckley, right to appoint and hold 3 of 9 seats on Beckley Psytech's board of directors, uh, time limited right of first refusal on a future sale of the company, asset sales or other transfer of commercial rights, indefinite right of first negotiation for BPL 003 and ELE 101. So, let's look at this here. BPL 003, they believe it could be first in class 5-MeO candidate for treatment resistant depression. Um, Again, I said intranasal formulation. They make it clear that they are probably excited that it's less than 2 hours in clinic for both BPL 003 and ELE 101. The IP, obviously, they have granted patents. For a fact that Ty would not go into this investment if they didn't do a lot of due diligence on this. And now here's where, again, like I said, create.
Can we touch like real quickly back on the other page? I want to just cover the ELE 101 for a second. I just want to give
Sorry,
my
I
perspective
did.
on this.
Okay, I did pass that a little bit. I am
No, no
excited.
worries, no worries. So, guys, Jake is very excited about BPL 003, which is a 5-MeO DMT. We all know he's a very big fan of the Toad 5-MeO DMT. So, for me specifically, I'm extremely, extremely excited by IV psilocin. I think that there is a tremendous, tremendous potential here. I really actually covered it in great depth with Trip Therapeutics, Jim Gilligan. I will link the interview in the description. You guys can check that out, where we really, really get into the weeds in regards to IV psilocin and the tremendous potential it has. But in general, I think being able to get somebody into that peak psychedelic space in regards to that psilocybin space, is so important. And with IV psilocin, you can do it so quickly. Those blood plasma levels will get up there so quickly, and you can keep them there for as long as you need to. They're aiming for a shorter duration here, but for from where I'm sitting, obviously we can all agree that people might be averse to an IV, any IV psychedelic. I think IV psilocin will be so much more effective than any type of oral psilocybin or psilocin that they will have out there. And I stand by that. IV psilocin, in my perspective, has tremendous potential, and this is what I'm most excited about in regards to this partnership with Beckley. And I am extremely excited that Atai has access to this within their pipeline now. It's tremendous.
And so with what you said about IV, obviously it's not ideal. I agree with you. However, when I've spoken with people involved in these trials, looking at IV, it doesn't seem like it's that big of an issue.
It really isn't. I'm
Yeah,
sorry to interrupt. It really isn't. When I did my ketamine infusion, I can tell you, once you're in the psychedelic state, you do not feel the IV in there anymore. It's really not a big issue. I think the bigger thing would be motivating people to kind of get to the point of trying the IV. That's going to be the biggest hump, but I don't see it being
yeah.
that much of a big issue.
Neither do I. Obviously the IV setup is not inexpensive though either. That's also something to think about. But I mean, these programs, Adam, are very exciting. And like I said, talking about creating value for shareholders. Phase 2B readout in the second half of 2024, late stage trial in treatment resistant depression for BPL-003. They also I was a bit confused why they did this. I'm sure they had their reasons. I'm not going to pretend I know why they did this. I only like to speak about things I'm like 100% certain of. They do also have a phase 2A open label readout that's coming out pretty soon, first half of 2024. So that can maybe give us some hints of what to expect with the phase 2B. And I know it's not as advanced, but 5-MeO DMT for alcohol use disorder. I think it's going to be game changing. And like I said, I think I texted my friend the other day, and obviously I'm hyping it up a little bit, but I'm putting my money where my mouth is. I think that these results that come out of these trials with 5-MeO, these are big words. I think they're going to look so good that they like look fake. Like people are going to be like, how is this even possible that we got these great results? I stand by that belief. We'll see when the results come out. Obviously mental health is not a one size fits all approach. But again, overall, I think the results are going to be, I'm anticipating them to be even better than what we see from longer acting psychedelics. Um, and also people need to also understand when comparing these trials, you need to look at the indication that each company is going over. There's a big difference between MDD and TRD. So keep that in mind. But yeah, the catalysts and ATAI is very clear that they want to differentiate their pipeline based on delivery mechanisms, different mechanisms of action, um, and they're just so diversified now. And we didn't even talk about their own programs that they have. VLS-01, EMP 01. Um, it's cool to see ATAI invest. They actually originally started out as a holding company. That was their original thing. It's nice to see them come back to their roots a little bit. Obviously, I still think they're going to develop their own assets, but I would not complain if they're waiting for some of these very small companies with promising assets to bleed out even more and say, all right, we're going to come in, take out maybe 35% of your company, and that money you'll use to get your drugs through their proof of concept data potentially, or maybe even into it if they're a preclinical company. Get through phase 1. ATAI is more than just a group, than just having an amazing medical team. They have a group of very savvy businessmen, venture capitalists, and I trust that with their investments, they know what they're doing. I firmly believe that. So I just, I want to go through the rest of their pipeline with you, Adam, but I think the summary is very key here for kind of their thought process around this investment. Conviction that short duration psychedelics could drive broader patient access. Multiple additional catalysts in next 12 months with addition of 2 patent protected clinical stage programs. Reinforces ATAI as the biopharma company with largest, most diverse portfolio of clinical psychedelic candidates. I listened to the investor call, Adam, and Christian Angermeyer said, we don't want to be a psychedelics company. We want to be the psychedelics company. And they have everything covered. Last 3 weeks ago, I said it myself. I posted it on Twitter again. I thought it aged pretty well. I said that in the past, Christian said that they had every psychedelic that made sense commercially and medically, but I argued they were missing 5-MeO, and it looks like they also thought they were missing out on 5-MeO. And the fact that they were able to get in at such an amazing valuation into Beckley is amazing. I'll just finish up here, Adam, and then I'll bring it to you. BPL-003 has potential to become first-in-class short-duration psychedelic treatment. Synergies through collaboration and preparation for commercialization. They're also, I think, going to look at digital therapeutics together, which is very interesting. So, Adam, before we move to their revised investor deck outside of this one, how are you feeling about this? Are you how big is this? Like, do you think that it's like maybe being overhyped, this news, or do you think that, or do you share the excitement that I do? And be honest.
So I have been on record in videos, in episodes that we've put out, saying calling ATAI Life Sciences dead money for the next X amount of time. This was months and months ago, maybe close to even a year ago.
Sure.
And I was just unsure where they were going to bring shareholder where they were going to get shareholder value from. How are you going to deliver that? Because when you were looking at their catalyst and their pipeline, it was just things were really far out, and there was just nothing in the short to midterm. Um, and also it was very easy, and I'm guilty of this too, of kind of also doubting ATAI Life Sciences a little bit and being like, all right, we'll see what happens. And just for lack of a better term, we're sleeping on them.
Mm.
But I think what this move does is it reinforces to the psychedelic biotech sector at large that ATAI Life Sciences is not messing around. They're not playing games. And this was a power move. This was tremendous. And I think when you're looking at the psychedelic biotech sector at large now, I think without a shadow of a doubt, say Atai is right back there being the elephant in the room again. Obviously, I have a lot of respect for Compass, but at the end of the day, Compass is essentially just Comp 360. Atai Life Sciences has solidified themselves, at least right now, reinforced that they are the most significant player in the space right now. And this move, once again, just shows how serious and how it's very easy to doubt companies when there's like a news drought. But at the end of the day, Atai delivered in spades here. This is extremely exciting. And once again, I am also an investor in Atai, and this Atai is actually one of the few psychedelic companies I am invested in right now. And this, as a shareholder, it's extremely it's exciting. And it is, I feel like, reigniting a lot of excitement within the sector itself too, which is awesome because we're all kind of just giddy.
That was really well said. That was really well said, Adam. And again, I'll say it again, brilliant investment. The valuation that they got was, I think, ridiculous for the potential of this company. And with that, we are going to move on to their other investor deck. All right, everyone. So now we're going to look at their other investor deck, their January investor deck. I'm not going to, you guys can read this yourselves, but I will focus right on just what they've accomplished so far, especially now that they're looking at investing in the space. It seems a little bit more validated operating model and ability to capture value. That's big. They got in very early in Compass Pathways. And the IPO of Compass Pathways adds to their investment savviness, I guess. Like Beckley, for example, if they IPO or get bought out, that'll be another thing to look at. And Adam, we didn't even discuss that they're invested more into IGXT now, which I know you're very excited about. So, again, like I said, more than just an amazing medical team, these guys have savvy businessmen and investors working for them. They really do. Also, Adam, I was very excited to see that they still are giving I guess, guidance that they have runway into 2026, and now we'll look into how they were able to do that. It does seem that phase 2B results for RL007 were pushed back, and it looks like they are looking at external funding slash strategic partners for GRX 917.
Oh, I can't wait to talk about that.
All right, so talk about the pipeline that these guys have either through in-house programs or strategic investments. I was like when I saw this, like I was just like, this is. I was obviously, you can tell, Adam, I've been over the moon excited about this recent move. But when I opened up the new investor deck and I just saw all of this, I said this is very impressive. I mean, just look at all these programs. You know, we went over them already. Also, it's nice to see that they're looking at new chemical entities with through entheogenics biosciences, which they actually now own 100% of. They used to own 80%. And I think their non-psychedelic programs are also promising. But now let's look at the catalysts here, and I'm going to read through them because it's quite a bit. So, as many people know watching this, ATAI owns 15.5% of Compass. Another great investment, in my opinion. You got phase 2 PTSD data in the spring of 2024, phase 3 data for TRD in summer of 2024, phase 3 TRD pivotal trial top line data mid 25. And then with BPL 003, phase 2A, open label and treatment resistant depression, first half of this year. Phase 2A open label and alcohol use disorder in mid 2024. Phase 2B TRD data in second half of 2024. It seems that the big catalyst this year coming for ATAI are through their strategic investments. And I obviously think that they have a long-term view with Beckley. Like, that's my opinion. But also, if they need to raise again in the future, they need to start adding value. And they really have. They really have. And Adam, with ELE 101, phase 1/2A open label data and MDD in the first half of 2024. I mean, how many catalysts have I just listed off right now? Then VLS-01 phase 1B first participant dose in the first half of 2024. Adam, you and I have
I'm
talked about.
particularly excited for that one,
Yeah,
in general.
you want to talk about it more?
I just think that so if they can iron out kind of the patient experience, right, with these strips. Um and when we spoke to Srini Jake, he had mentioned that it was supposed to be like an ayahuasca experience. So not necessarily a DMT.
Well,
Um
sorry, Adam. To correct you, he did say somewhere in the middle it may be.
Okay,
Is
cool.
okay.
So,
Sorry.
but I just think that so in terms of the way I'm looking at it, I think for me conservatively, it like if the worst case would be an ayahuasca like experience, that's still a huge win for me in terms of that perspective. If you can get somebody with these strips into like the mystical DMT realm, that is a tremendous win. Tremendous win because number one, you're doing it with these oral dissolvable strips. There's no needles involved. The onset is very quick, and I think it's a 45-minute experience, right?
Yes, and you don't need the IV setup, which again we said is not inexpensive. You don't need specialists to use that IV delivery method. Maybe in the future, you could go to your psychiatrist who's maybe got some training on psychological support with psychedelics, and you just take the oral transmucosal film. I'm very excited about this program.
And listen, if this works with DMT and it's extremely effective and the patient experience is very good, just the applications for other psychedelic drugs here, in my opinion, are
Yeah,
tremendous.
yeah,
So I just think that it I have my eye on VLS-01. I'm extremely excited about this, and that first half of 24. Just want to find. I just can't wait for them to kind of start putting out results in regards to this trial.
Yeah, it's gonna be. I'm excited for it, and it's nice that again with their pipeline, they in my opinion now they do officially have every psychedelic that makes sense medically and commercially. To wrap this up, Adam, and I'd love to hear maybe some if you have any closing remarks, but again, just reiterate, I think this move is ginormous. I am again through the moon happy, and to see again that there's so many catalysts now for ATAI specifically. We have these we people can't forget these other catalysts we have with coming up soon in February. If FDA gives priority review to MDMA therapy, that shows they mean business. They've already given it breakthrough therapy designation. I hope that they give it priority review. Now, I will say the problem is with this approval process for MDMA therapy is that the FDA only regulates drugs. They don't regulate therapy. So it may not be as clear cut as some people are hoping for. I do, however, think that eventually, I don't know when, MDMA therapy will be approved. The results are just too good from their phase 3. The current standard of care for PTSD is quite honestly just pretty trash. Obviously, it works for some people and maybe even a lot of people, but there's also a lot of people who it does absolutely nothing for. SSRIs, for example.
All right. So in closing, basically where we stand here with ATAI, they went from having basically almost like very few catalysts within this next year to having a significant amount of catalysts within this next year. So this move in terms of the strategic investment in Beckley Psytech has completely changed the landscape for the next year for ATAI. And once again, I can't stress enough how big this is for investors. This is exactly what I was hoping would happen. I did not realize, I did not think or consider what happened with Beckley Psytech. I was, I would have been happy with something even smaller than that. But the fact that they invested into Beckley Psytech is extremely significant, and I can't stress enough how much of a powerful and a just once again significant move this was by ATAI. So all in all, I'm extremely happy with how everything played out for ATAI, and I am very excited to see kind of how things progress throughout 2024. Do they have any other strategic investments or acquisitions in the pipeline? Is this just the start of kind of what is this just the beginning? Who knows? But it's definitely making things a lot more exciting.
Absolutely. And with that being said, everyone, thank you so much for watching. Please, if you enjoyed this, like and subscribe. Also follow us on X at Psyched Insights. Thank you very much and have a great day.
Have a great day, everyone.